All right, hey everybody, welcome to the latest edition of our virtual question and answer session. We are very fortunate this morning to have Governor Mark Parkinson joining us. As everybody I'm sure knows, Governor Parkinson is the Chief Executive Officer of the American Healthcare Association and the National Center for Assisted Living. Good morning, Governor, how are you?
I'm doing fine, Mark. Good to be with you.
Thank you. We last had a chance to catch up late May 2020, kind of on the front end of the pandemic, if you will. Fast forward to where we are today, is it a bit too optimistic to think that we're on the tail end of this?
We're definitely approaching the tail end. As we record this today, I'm happy to report that the first round of vaccine clinics have occurred in every building in the country. Every skilled nursing facility, there are still a few ALs that we need to get vaccinated in the first round. I think the second round will be in every facility by the end of February. And I believe that we're going to see a dramatic reduction in COVID cases over the upcoming 60 to 90 days. I actually also think we're going to see a dramatic reduction in COVID cases in the general population. The data over the last 14 days have been very encouraging. So the clinical nightmare will be behind us, but the business nightmare isn't behind us. The business nightmare we aren't at the end of, we're in the middle of, and that's because of the dramatic drop in census and the incredible work that's going to have to be done to get us back to where we were before this nightmare began. So clinically, yeah, we're at the tail end. Financially, no, we're still in the middle.
With the news coming out where states and just the expansion of the vaccine program seem to be expanding outside of just phase 1A, are you hearing any concerns about vaccine availability?
Well, I think the vaccine program is a tale of two cities, and the good news is that the long-term care part of the vaccine rollout has gone relatively well. I think that the rollout to the general public has been a disaster. And the data clearly indicate that. Fortunately, with respect to our space, it's gone pretty well. Not perfect, but it's gone pretty well. And as I indicated before, we're making great success in getting people vaccinated. In terms of the general public, the problem that the politicians made, and I'm a former politician, and I knew it when they were doing it, was that they overpromised. And you never want to overpromise and then underdeliver. And so when the Trump administration said we'd have 20 million people with their first dose by the end of January or end of December, I didn't think it was possible. And unfortunately, it wasn't possible. And it made them look really bad. If they hadn't made that statement, if they'd set the expectations at the right level, I don't think that the perception would be that bad. I mean, it is truly remarkable that we've gone from basically not having this virus in our country at the beginning of 2020. And by the end of 2020, we had 2 vaccines that were 95% effective. That's a monumental achievement, but because they overpromised on the vaccination numbers, they're being widely criticized. So, long story short, the development of the vaccine, amazing. The distribution, bad. But it looks like people are now getting their act together. My view of it right now, and Mark, you'd have a better understanding of this with what you do, but my view of it now is that the distribution part of it has been pretty well figured out. It took the states 4 to 6 weeks to get their acts together, but they've pretty well got their acts together now. The problem now is supply. There's just not enough out there for all the people that are willing to take the vaccine. So I'm hopeful that President Biden will ramp up production, maybe through the Defense Production Act or some other means, because every single day that goes by without us defeating this virus is devastating. So I think the distribution channels have now been figured out, but you'd actually be the better person to answer that question. I think it's a supply issue at this point.
I guess one of the things that pops in mind when I see the expansion of the program roll out is there's been a tremendous amount of resources dedicated to vaccination clinics at the long-term care facilities. Now, by expanding it, there's going to be kind of retail needs where there needs to be staff and supply at different clinics and drugstores around the country. So is there any concern that there's not going to be the resources available that there was simply for phase 1?
I think the resources will be there. The Biden administration is, as anybody would be, incredibly committed to making sure that the vaccine occurs as quickly as possible. They'll either get some emergency funding through Congress, or they'll just, take some money out of some other budgets. So I think the money will be there. I think there's obviously workforce issues, in certain parts of the country. Can you actually get the folks that are necessary to administer the vaccines everywhere? But they seem to have figured that out. And so I really think it comes down to supply at this point. And, the critical issue, as we sit here today, we don't know about the phase 3 results from Johnson & Johnson. They announced their earnings this morning, announced that their phase 3 clinical data would be released early next week, early the week of February 1. If the Johnson & Johnson vaccine works anywhere near as well as the Pfizer or the Moderna, that's a complete game changer, because that's 100 million doses in a single dose that can be stored at regular temperatures. And that's going to end the nightmare. On the other hand, if the Johnson & Johnson vaccine doesn't work, and that's possible, Merck just pulled all of its work on its vaccines. It's not easy to produce a vaccine. But so if the J&J vaccine is not effective, it's really, really bad. So that's the main thing I'm looking at right now.
I think what gets lost a lot of times talking about the vaccine, whether it's Pfizer or Moderna, those are averaging in about 95% effectiveness. I mean, that by far and away blows away the typical flu vaccine that we all take on a yearly basis. So, what has been accomplished in the short amount of time, just developing the vaccine, to your point, and to get it to the effectiveness that it is just tremendous and outstanding. I think
astonishing. Somebody needs to be winning some Nobel Prizes over these vaccine developments. The cool thing about it is it's not just unique to coronavirus. They've developed an entirely new way to develop vaccines. So what they did with coronavirus is going to help us with all sorts of future viruses and diseases in the future.
Well, I know that there's just such a vast network of independent long-term care pharmacies that operate day in, day out to the nursing home industry, the assisted living industry. As this expands, would you be supportive of pulling in that broader network to make sure that the needs of the facilities are met?
Yeah, absolutely. I mean, one of the real shining stars of the vaccine program has been the independent long-term care pharmacies. When you look at the success of vaccination, particularly in the first 2 or 3 weeks when the vaccine was available, it was the independent long-term care pharmacies that were really standing out. And the best example would be West Virginia, where the governor opted out of the Walgreens CVS program and instead utilized all of the local long-term care pharmacies, and they dramatically beat every other state in terms of getting their first vaccine out. There are some other states where independent long-term care pharmacies were allowed to be involved in the distribution, and those also did well. Oregon is another example where Consanus was approved. So yeah, the long-term role of the long-term care pharmacies is obvious, and we are completely supportive.
Wonderful. Well, we could spend all the time we have allocated talking about COVID and the vaccine and things like that. But I think, over the last, 8 months, even within the pandemic, there's been some other, severe impacts to the industry. And one of the surprising ones was the proposed physician fee schedule cuts for Medicare Part B that were proposed and went through the final rule and then went into effect January 1st. Were you kind of surprised that in the midst of the pandemic, census going down, that CMS would propose at that point what was a 9% cut? I think common sense is factored in, and there were some offsets that brought it to give or take 2%.
Yeah, I mean, first of all, let me say that we were pleased that our rates weren't cut. So if you look at our Part A Medicare post-acute rehab rates, we actually got an increase in 2020, and we hope to get another increase when they announce our rule in May of 2021. The physicians and the other Part B providers did take this dramatic cut. And typically that's not an issue that we lobby on directly, but because the cut was so deep, we felt like it directly hurts a lot of our really important partners. So we jumped in and we got involved. with a big coalition of people that said exactly what you just said. How in the heck can you cut these folks' rates when we're in the middle of a pandemic? And fortunately, reason prevailed, and the cuts weren't completely eliminated, but they were largely eliminated. And who knows what happened? It may have just been a bean counter that got overly zealous in terms of wanting to look good on their overall budgets. But fortunately, for the most part, we were able to help get it fixed.
Right. You had mentioned something a few minutes ago just about occupancy and the impact that the pandemic has had really across the board in the industry. Recent numbers show average occupancy as low as 80%. Industry giant Welltower reported recently, as of January 15th, they were at 75.3. There's some other news about Texas out this morning at 56%. Just the story, we're hearing stories of facilities closing, facilities selling, a lot of new ownership groups coming in the marketplace. What does your prediction look like as we kind of tail out of COVID and census potentially rebounding through 2021 and beyond?
Well, we have more census data than we've ever had before. And that's because skilled nursing providers are now required every week to submit to the NHSN portal our COVID statistics, including our census. So we know exactly where we're at in census. And as you point out, Mark, it's not good. So we actually started the pandemic at about 80%. And immediately after the COVID crisis hit, by June 1 or so, we were down to 72%. And we stuck at that level for basically the next 6 months, down about 8 or 9% for the next 6 months. We got all the way to November 1st, and instead of being at 72, we were at 71. And I was thinking, and I think a lot of industry leaders were thinking, down 9%, we can get our vaccines, because it was clear then that the vaccines were coming. We can get everybody vaccinated, and we can recover from this thing. And we can see the light at the end of the tunnel. Well, then the third wave of COVID hit, this massive wave where, we peaked out on January 6th of 306,000 new cases in a single day. Just a massive wave of COVID that started in November and is just now declining. And unfortunately, that massive wave of COVID resulted in a massive increase in COVID in skilled nursing facilities and a further drop in census. So after going 6 months and only dropping 1% from 72 to 71%, in 3 short months, we've gone from 71 to 67%. So we start our recovery down 13%. That's tough. That's an unprecedented low. We don't know exactly where AL is at, but we think it's probably down 8 or 10 as well. My hope is that when we get past March 1 and everybody's vaccinated in our buildings and the numbers of new cases have clearly plummeted, and I think you'll see headlines that talk about that the public will feel more confident in our facilities, people will view them as safe, and census will start to recover about March 1. We need it to recover at a pace of about 1% a month. And that doesn't sound like very much, but it's not as easy as it might seem. If we can get census to recover at a pace of about 1% a month, by the time we get to end of 2021, we'll be in pretty good shape. If census doesn't recover at all, or it recovers slower than that, the sector has a real problem. What's going to happen? I don't know. It's anybody's guess. But what we do know is that last summer, when COVID rates had been ground down pretty low after the first wave, census started to recover in some markets. So, that gives me some hope that when we get this third wave behind us, we get folks vaccinated, that maybe this 1% that we need is realistic. And, we're going to know, we can guess, but there's really no reason to guess. All we can do is everything that we can do and just see where we're at. We need to recover at about 1% a month. And my hope is that is what will happen.
Are there things that operators can be doing today to prepare for when admissions become more prevalent, whether that's data, outcomes, things that they can prepare for today and be proactive to address that?
I think there's some really exciting marketing things that can be done around the vaccination program. And I can't name names because basically everybody in the sector is a member, and so I don't want anybody to feel like I'm promoting somebody.
Sure.
But people should go to their competitors' websites and see what they're doing about the vaccine. The smart and cutting edge providers, you're going to see banners on their pages of their website that say vaccines available for new move-ins. 100% vaccinated. We're getting safe. I would really be promoting to the public that vaccination clinics have occurred in the buildings and that X percentage of the residents have received them, and that you're welcoming new residents and have available vaccines. I would absolutely be talking to all of my referral sources, whether they're managed care companies or hospitals or social workers or discharge planners, whatever, about this vaccination programs that we had in our buildings. And I would be doing everything possible to increase the rate of staff uptake on vaccinations, which has been low. But again, smart cutting edge operators are doing smart things to get their numbers higher. Offer bonuses for people to take a vaccine. I mean, hell, it may seem like it costs a lot of money to give 100 people in a nursing home $250 to take a vaccine. Well, if you can get them all vaccinated, that $25,000 will pay for itself with one admission, with one less COVID case. So I would look at bonuses. We've got resources on our website. We've developed a Get Vaccinated campaign, and the people that have used the resources that are on our website have told us that their vaccination rates have gone up. So I would, we've gone from a place where there's been story after story for the last year about how dangerous nursing homes are for older people. Well, now that we've been vaccinated first, the safest place in the world right now for older people in America is in nursing homes. And we need to let people know that.
Yeah, I think it's certainly understandable, I think, to see vaccine hesitancy. But I think there's just so much that we can do from an education standpoint as we get further out from the first vaccinations, and we get more data that tells a very positive story. Hopefully those numbers, like you said, will continue to tick up, especially on the staff side of things. I know as a former politician, it's been a pretty eventful time in DC over the last couple of weeks. But really with the administration moving to a democratically controlled government, Alex Azar's out at HHS, Seema Verma's out at CMS. Mitch McConnell is now the minority leader. He was the majority leader when we spoke back in May. Do all of these moving pieces create opportunity in the industry that didn't exist before, or is this problematic?
Yeah. Well, first of all, I'm a former politician, but I was the worst politician in the history of politics, so I'm not sure I'm the right person. I did so many things wrong. When you multiply two negatives in math, you get a positive, and that's what I did. Everything I did was wrong, and it all multiplied together, and somehow I ended up as a governor. We are better off when one party does not control everything. When one party controls everything, you just look historically, and that's when we've faced some real challenges. So, I want to say we have some opportunities, which we do, but we also have some real challenges, and the challenges will be on the regulatory side. I'm a Democrat, but Democrats, generally are more pro-regulation, less willing to look at things like tort control and liability control, et cetera. So we face some real challenges. I don't want to scare people, but we've got some real thorny issues that we have to deal with. Now, Democrats tend to be better on the funding issues. So we should be in pretty good shape on the Medicare, Medicaid issues, et cetera. But we've got some real challenges on the regulatory side.
I know when we spoke back in May, Leader McConnell was pretty adamant about liability protections and provisions within the industry. Not sure that played out, as planned. With where we are now, is that a past thought, or is that still something that has life in it?
Yeah, that's an example of what happens when one party controls everything. So if the Republicans had control of the Senate, Leader McConnell would be in there really fighting for some liability protection, which he'll still fight for, but he doesn't really have the leverage to pull it off now. So what we're going to have to do is we're going to have to get a few Democrats to go along with the Republicans on that issue. And the other thing that we're also doing is we're going back to the states to say, hey, if you don't have liability protection in your state and you've got any shot at it, we really need to redouble the efforts, because getting it at the federal level, now that the Ds have everything, is going to be tough.
Perfect. Well, Governor, you're always incredibly gracious with your time. We certainly appreciate it, and you're just a tremendous advocate for the industry. So stay safe. I'm sure you're looking for the time when you can get back out and engage with your members and see everybody in person instead of virtually. So
yeah, I'm really looking forward to it, and just want to really thank the members for everything they did in 2020 in their buildings. 2021 is going to be a better year, but as we talked about at the beginning of this segment, we're nowhere near done yet. So just hang in there, and things will get better.
perfect. Governor, have a wonderful day. Certainly appreciate the time. We'll talk soon.
You bet. Thanks, Mark.